having worked in public mental health for many years, my perspective is really informed by that lens. And I would say one of the key issues in Virginia is accessibility of affordable mental health care for all Virginians. There's real inequities in terms of what's available from one community to another, and also how accessible that is for people to be able to get to a place where they can get the services that they need and also affording them. And especially for people who struggle with substance use or addiction issues, is timeliness of services, being able to go somewhere and get help on that day. And so what I would think of in what some programs refer to as same-day access is one of the issues across Virginia. In the public system, in Chesterfield, we put in place a same-day access program where people could basically walk in and meet with a therapist right away. And resources were organized to be available to people right at the front end. And then there was a second level of follow-up services that were available in a timely way. That model is really important to spread and replicate throughout Virginia so that regardless of where people live, when they are motivated, when they are ready and know that they need to get some assistance, they can turn to a local organization and go there and get same-day access. There's a few things. One of them at the most basic level is funding, and prioritize that rather than react to the tragedy du jour. So Virginia has a track record of being responsive in the wake of tragedies and looking at ways to really invest in the public mental health system. But what's really needed is more of a visionary approach that makes sure that there's really adequate funding to have good, solid, community-based services available regardless of a recent tragedy. And I think that's been one of the challenges of how to have it be a high enough priority and see it as part of a larger public health issue that's important to Virginians to have their physical health taken care of, their mental health or struggles with addiction. In my mind, I don't separate those very much. They all seem like different facets of the same issue, which is our health and well-being. Part of the struggle, I think, in Virginia is the inequity between one community and another. If there's good local support and it's a relatively affluent community, there tend to be pretty good, robust, comprehensive services available for the people who live there. But you can go to an adjoining county that doesn't have the same set of resources available, and it can be a skeletal set of services that are available for the people that live in that community. So you don't get the same quality of care and the range of services available. There is a bigger issue to tie into also in terms of just being able to access affordable care, and that's the whole Medicaid expansion issue in Virginia. As somebody who's worked within a public system, I could see the benefit that that would have provided to so many people in our community and elsewhere in Virginia. And I think it is one of the things that our legislators can move to expand that floor for a lot of working families that are low income and really struggle with access to their health services in general, mental health being one of them. So Medicaid expansion would have been a real big plus for those families, would have been very beneficial. And from my perspective, investing in health and well-being of our citizens is being visionary. It's really looking out for the good of our state over time. So to not have gone with Medicaid expansion hurt a lot of Virginians. It really impaired our abilities to serve a lot of people who needed services. And often what happens then is you have more expensive services that are delivered at a later point because people didn't get the help they needed earlier. And that's true with physical health as well as mental health and addiction issues. Everything at the front end is more effective, more efficient. Prevention's the best.